5 sense organs in the body, namely the eye, the nose, the tongue, the ear, and the skin. Now 5 of them have their functions that they perform. The eye is for you to see, and the ear is for you to hear and listen, and the nose is for you to smell, the tongue is for you to taste, and of course the skin is for you to feel. Out of those 5 sense organs, one is very delicate and you need to take good proper care of it, and that is the eye. Now there are several diseases that could affect the eye, and one of such is glaucoma. That will be our focus on today's episode of Health Watch, plus a special segment by the medical director of Aurora Reproductive Health Care. He'll be telling us about endoscopic surgery. Endoscopic surgery. Have you heard that before? Find out on this week's episode of Health Watch. My name is Nkem Okibe. We'll go on a short break. When we return, you'll meet my guests. So stay with us. If you're just joining us, the program is Health Watch, reaching you on NTA Lagos Channel 10, the station for excellence. And before I went on that break, I talked about our focus for today, which is glaucoma. My guest today is the Vice President of the Ophthalmological Society of Nigeria. He's also the Chairman of the Ophthalmological Society of Nigeria Lagos State Chapter, and is also a consultant ophthalmologist in the person of Dr. Abiola Oyeleye. You're welcome to Health Watch.
Thank you for having me.
Now, I'm talking about the eye. The eye is very delicate, like I talked about, and we really need to take proper good care of it. Right. And one of the diseases that affects the eye is glaucoma.
That's right.
Please tell us, what is glaucoma?
Okay, glaucoma is the second most common cause of blindness worldwide, and glaucoma blindness is irreversible. So somebody who is blind from glaucoma, you cannot reverse that, and that makes it a very, very important health topic we need to make everybody aware of. Now, in terms of glaucoma, what happens is that the pressure within the eye damages the optic nerve at the back of the eye. Now, what is the optic nerve? The optic nerve is the nerve that takes any images we see from the eye to the brain for interpretation. So if the eye sees all the images that very clearly, but the nerve is not functioning, then the images can't get to the brain, and so you're not interpreting anything. So the nerve is very vital as being the messenger between the eye and the brain.
Okay.
In glaucoma, the pressure builds up within the eye. And how does that happen? The eye makes fluid and drains fluid internally at a continuous rate. Production and drainage continuously. At some stage in life, maybe due to age or due to other events, the drainage is not as good as it should be. So the eye is producing fluid and it's not draining very well. So there is build-up of fluid within the eye, which causes pressure within the eye. Now, the pressure now damages the eye at the weakest point, and the weakest point is where the optic nerve exits the eye to go to the brain. So all that affects the optic nerve, and once it's damaged, it cannot be reversed. And then it gets damaged further until it's completely damaged and leads to blindness. So at the end of the day, what we are trying to do is to ensure that people do not go blind from glaucoma.
Okay, talking about, you mentioned pressure. What kind of pressure are you talking about? Is the pressure that comes from walking around, like you move around, or you're stressed with the kind of job you do rather, or is it the stress that comes from light? Because we find that a lot of people have computer systems in front of them to work with. So is it the pressure coming from the light, or the pressure, you have to go from here to here, school runs, work, and all that?
Right, neither of those pressures you described directly will cause glaucoma. The pressure I'm talking about is the pressure within the eye, and it's what we call intraocular pressure, which is the pressure within the eye. So normal life's pressures do not actually directly cause glaucoma.
So which age group would you say is at risk of getting glaucoma?
Okay, everybody can get glaucoma. Some children are even born with glaucoma. However, it's most common you get glaucoma as you get older, in the 6th, 7th decade of life. Now, interestingly, in countries where you have a mixed racial population, blacks, whites, Hispanics, Asians, it's advised that blacks or people of Negroid extraction, once they get to the age of 30 and they have a member of the family with glaucoma, they should be assessed for glaucoma. And for the Caucasians, that's the whites, the age used is 40. So the fact that we are black raises the possible risk of us getting glaucoma.
Okay.
The older you get in life, the risks of getting glaucoma are increased. If you have glaucoma in your family, that is your first degree relatives, that's your parents or your siblings, then it even increases your risk of getting glaucoma. It does not mean that because your parents, one parent or both parents have glaucoma, you will get glaucoma. It just means you have a higher risk, and thereby make sure you get your routine checks done. Because glaucoma is widely known as the silent thief of sight, because we don't know when it starts. It comes quietly without symptoms, and it damages the nerve progressively until it gets to the end stage. So that's why we need to have routine tests for diagnosis of glaucoma. So I want us to say that every adult above the age of 30, if you have a family history, or above the age of 40, in our society, is at risk of getting glaucoma.
Oh, you just mentioned that there are really no obvious symptoms, and it's very worrisome when you say that, because we find ourselves in a country where people don't visit the hospital unless they come down with some kind of illness. So does it mean that some people could be moving around with eyes that are already damaged and they don't feel the need to see a doctor? Because if you wear glasses, or before you start wearing glasses, you just notice that you cannot read some things, you cannot see some things at some distance, and then you need to see a doctor. So if you're saying that there are no obvious symptoms of glaucoma, it becomes worrisome, because people want to also look at it and say, when I see something brown, when I see something, I need to see my doctor. So what would you see are the symptoms or the signs that there's something wrong with your eye, you need to see a doctor?
Okay. There are two types of glaucoma: the acute type and the chronic type. The acute type is the type that happens suddenly, and that's not the common type in Africa. What we have in Africa commonly is what we call the chronic type or the open angle type. So for the purpose of this program, we are talking about the chronic or the open angle type. Now, the chronic or open angle type has no symptoms whatsoever until the very advanced stages. So what happens when you start bumping into things is because you have lost your peripheral vision. Glaucoma affects the peripheral vision first, so you might stop seeing things on the side. You might still be able to see straight ahead very clearly, and your vision on the side or the peripheral vision may be diminishing. And you might, once you start bumping into things, either maybe you might be driving and you find out you're not judging things, you're hitting one side of the car, that may be a symptom of glaucoma, but by then the glaucoma is quite advanced. So usually it's picked up when you go for an eye test, or sometimes it's just picked up routinely when you might complain of something else and they look into your eyes. The doctors look into your eyes and they say, oh, there's a problem with your optic nerve, and then they go on to make a diagnosis of glaucoma. So that's what makes it very important for us to have routine eye tests.
Thank you so much. We'll go on a short break now. When we return, Dr. Abiola will be telling us on the preventive measures. Of course, you know that prevention is cheaper and better than cure. We'll be right back after this time. Stay with us. If you're just joining us, the program is Health Watch, and we're talking about glaucoma. And on set is still our Dr. Abiola Oyele, who is a consultant ophthalmologist. Just like I said, prevention is better and cheaper than cure. What are the preventive measures? Are there some class of food that you need to eat to ensure that your eyes are healthy?
Okay, in terms of glaucoma now, early detection is what we preach. Early detection, and that's by going for tests. There is no diet that will prevent glaucoma. However, having a balanced diet is good for the eyes. A diet that's balanced with fruits and vegetables is good for the eyes. Some people believe that there are some foods that are not good for the eyes, like they say, oh, gari is not good for the eyes. We've had this in the past where you had some adulterated types of gari that cause problems with the eyes. Yes. Some people will say don't eat granules because it can cause you eye problems. What I'll say to all that is if you have most things in moderation, it shouldn't cause you any problems. Okay. So just eat a balanced diet.
So what's this? A lot of people say glaucoma cannot be cured or cannot be treated. I don't know how true that is. I want to know your take on that.
Glaucoma is irreversible. That's the glaucoma damage to the eye is irreversible. That means it cannot be cured. However, we can treat glaucoma, and if it's treated adequately, the vision does not get worse. The vision is maintained for the rest of the patient's lives or the patient's life. So it can be treated successfully, but if you've lost most of your vision by the time you come for diagnosis or you present, then that cannot be reversed. There are three ways we treat glaucoma. The first modality is medication. Medication usually in forms of eye drops, sometimes tablets. But medication is by and large the number one way we treat glaucoma. Then we have laser surgery. Laser surgery, there are special lights that we apply on certain areas in the eye to help the drainage or to alter the drainage within the eye. So laser is another way glaucoma can be treated. And the third way is to have surgery. There are many operations towards treating glaucoma. So I'll just leave it at that. You could have medication, laser, and surgery. But by and large, we first try to give medication. You might give one type of medication. If that's not enough, you may actually change the medication or add to that. And once your ophthalmologist thinks that you reach the stage whereby medication is not helpful, you should be offered either laser or surgery to help with the treatment of glaucoma.
Okay, doctor. In 1 minute, what's your message to Nigerians concerning eye care?
Okay. First of all, Nkem, when did you have your eyes tested last?
Okay, I use glasses, and so I do a regular checkup like every 3 months because I'm short-sighted, so I need to always watch my eyes.
Okay, so my message is we need to have our eyes tested regularly, just routinely. You don't need to have problems, just have a test once a year. An eye test is not that expensive. Blindness is expensive.
All right, doctor, thank you so much for coming on Health Watch. It's important that people understand how delicate the eye is. It's important that people also re-emphasize the need for you to see your doctor, because it's not just about watching the program on TV, but it's also for you to go back home and do what you've been asked to do. Go back, see your doctor, and check your eyes. Thank you so much.
Thank you for having me. Thank you very much.
Moving on is our special segment on the medical director of Aurora Reproductive Health Care. He'll be telling us all we need to know on endoscopic surgery. Have you heard that before? Find out on the segment. We'll be right back.
Hello, my name is Dr. Edmund Ediosage. I am a gynecologist and my specialist area is reproductive medicine and surgery. I'm here to talk to you today about endoscopic surgery. This is a real passion of mine and something that I'm bringing to women of Lagos and Nigeria. Endoscopic surgery is really beneficial to women of African descent because of our particular predisposition to form excessive scars and keloids, because it does leave women with much finer scars, in addition to some of the other advantages of endoscopic surgery, which include things like faster recovery from surgery, better access to deeper pelvic tissues, and less adhesions and less risk of complications. One of the great surgical revolutions of the last maybe 50 years is the introduction of endoscopic surgery, but it's only in recent years that we're beginning to see hospitals include endoscopic surgery within their surgical armamentarium. My purpose of talking to you today is to introduce endoscopic surgery and to encourage women in Lagos, in Nigeria, to think about seeing a specialist for endoscopic surgery if they feel that they might benefit from this. There are two main types of endoscopic surgery we offer. We offer surgery that we perform through the tummy, through the belly button, called laparoscopic surgery. And we also offer surgery that we perform through the neck of the womb, called hysteroscopic surgery. And there are various conditions that we use these surgeries to manage. If we take laparoscopic surgery, for instance, it's a very, very important way of managing women with endometriosis and pelvic pain. Endometriosis is one of those conditions that causes a lot of pain, a lot of poor quality of life, and causing fertility in women. And a really, really useful way of managing the condition is to do endoscopic surgery. Laparoscopic surgery gives us very good access to deep pelvic issues. It magnifies the endometriotic lesions within the pelvis, so we're able to see them more easily. We're able to remove them safely. And in the vast majority of cases, for the straightforward endoscopic laparoscopic surgeries we do for endometriosis, women are able to leave hospital on the same day and be back to work after only 2 weeks. This is compared to the traditional open surgery, where women spend at least 3-4 days in hospital and have to be off work for about 6 weeks, not earning any income. The other form of endoscopic surgery is hysteroscopic surgery. And hysteroscopic surgery is where we put in a telescope through the neck of the womb to look into the womb, and that way we can remove things like fibroids, we can remove things like polyps, we can remove things like adhesions within the lining of the womb. And all these are things that can impact very, very negatively on women's fertility. And for the first time, we're able to do these operations in a very, very minimal access way with very reduced risk of complications, and the vast majority of them can be done as day case procedures, so women only spend just that day in hospital. Now, there are many hospitals around the Lagos environment and across Nigeria now offering such surgeries. My advice to women is women who suffer from conditions like endometriosis, fibroids, cysts in their ovaries, or women who need to have operations like hysterectomies should speak to their specialists about whether these conditions can be done for them by endoscopic surgery. And endoscopic surgery doesn't cost the bank, okay? There are many places now where such surgeries are very, very affordable. With laparoscopic surgery, you'll need to have a general anesthetic, meaning you need to be put to sleep, and you'll have a cut made through your belly button where a telescope will be put in to have a look inside your tummy and your pelvis. And for the vast majority of operative laparoscopic operations, you have maybe 2 or 3 other small cuts in the tummy where other instruments will be put in to have a look and to deal with whatever condition it is that needs to be dealt with. The vast majority of such operations will probably take 1 or 2 hours, and the vast majority of women will be able to go home following those procedures. Thank you for listening to me, and once again, I'm Dr. Ediosage, a specialist in reproductive medicine and surgery.
the much we can take on this week's edition of Health Watch. Remember what the doctor said. He said eye test is cheaper than blindness. That's for you to think about it. I'm sure it's a food for thought for this week. Remember to send your comments and inquiries to okibinkem@gmail.com, healthwatch@gmail.com, and send a text only to 07060865487. Thank you for being part of this week's episode of Health Watch. My name is Nkem Okibi. See you next week.